Welcome to another episode of the Peak Potential Success Show. My name is Fong. I'm an entrepreneur, business strategist, real estate investor, speaker, and also best-selling author. And every single day, I help others unlock potentials and guide them to succeed. Today on the show, we have a fascinating guest. I've met this person a few times at business conferences, speaking conferences, seen him on stages. I've heard him speak. He always has this great smile, and he's really, really good at what he does, which is generally something I don't approach because I try to stay away from them as much as I can unless I absolutely have to see them, which is kind of odd because I'm very excited to talk to him today. He helps a lot of his clients sleep better, feel better, also breathe better, and eliminate pain. Now, these things are generally stuff that we don't associate to teeth, which is what he does. He is a functional orthodontist, the Airway Dentist. He's an award winner. He speaks all over the world. He lectures, teaches all over the world on his expertise. He basically optimizes your health way beyond your teeth. So please welcome the Airway Dentist, Dr. Robert LIN.
Hello, everyone. How you doing? Thank you for the kind introduction.
Hey, awesome for having you, and thanks for your time. I know it's very late where you are, so we'll get started right away. My very first question, single time I meet people in the dentistry industry, is why dentistry? Because I try to stay away from you as much as I can, but you guys choose it. So what's your journey? How did you become the dentist, and what you do today?
It's a funny story, really. But now, when I come to think back on my journey, I think I was destined to be one. The reason being, like, honestly, I had some decent grades in high school. I got into university. I had some friends who were a little bit older give me some advice. I knew I wanted to do something with health because I enjoy health, helping people. And I was pretty good at science. And so, yeah, so they told me the advice they gave me was, just get the best grade you can and see what courses you can get into. And in all honesty, you know, when I weighed up dentistry and like medicine, the medical journey is actually a lot longer. And I'm kind of like, you know, I mean, I do enjoy study, but if I wanted to become a medical specialist, we're looking at like 15 years of study. And yeah, you know, I wasn't, I guess I wasn't prepared to put in that much effort. So I thought, 5 years of dentistry, graduate from uni at 22 years of age, come out with a good income, good job. And yeah, that's how I started. So yeah, but once I got into dentistry, however, there's so many different areas of dentistry. Like you may have heard, some people might really enjoy pulling teeth out, which is scary. Some people enjoy doing root canals. Some people do implants, veneers. Some people do orthodontics, like myself. So like there's so many different areas you can get into, and I kind of fell into this airway and functional orthodontics because of all the things I suffered myself when I was younger. So, and it was actually my mentor, who is also a dentist. He picked up all these issues that I had when growing up. I had a lot of health issues myself, especially breathing and sleep. And a lot of doctors and specialists couldn't tell me what was wrong with me. So it took a dentist to figure that out. So that really got me intrigued. And that was 10 years ago now, back in 2013. So since then, I've been on a relentless journey of just gaining knowledge and just perfecting my craft in this field to help people like myself who, have breathing issues or sleeping issues, to breathe better, feel better, have a better quality of life. Yeah.
Wow, fascinating. Because for me, I think the first thing that comes to mind is, man, I'm gonna be looking at people's mouths for the rest of my life. Do I really want that? Has that ever come into your mind or thought about it at all? Or is you know what, this is what I do?
At the beginning, maybe yes, but yeah, now I don't. It's funny because you can actually learn a lot about someone when you look into their mouth.
Wow.
So you can learn that you can look for signs of, say, if it's quite common for people to say grind their teeth in their sleep.
Yep.
So one of the first things I look for in a patient, like when I look into the mouth, I look for blockages. So if someone has a long, soft palate, long uvula, big tonsils, big tongue, they could potentially be a snorer or have sleep apnea. So these are just a couple of the things I look for when I examine a patient. So
Mhm.
I'm looking far beyond teeth, not like, whereas in dental school, we only pretty much train to treat teeth. So everything I've learned has like that I treat now has been just like, a decade of learning post university.
Mhm. Well, something you talked about during that segment there was how people are able to sleep better, how they're able to breathe better. And like I said at the very beginning, that's generally stuff that we don't associate with teeth. The first thing we would think about is go to the doctor. Hey, is there something with my congestion, my nose or something? But we don't go, hey, maybe we need to go to a dentist to check this out. How does that all relate, and how are some of the things that you do help people sleep better and also breathe better?
Well, I'm not sure exactly how it is in every country, but I can obviously talk to you from my experience in Australia. Just looking at the like research articles, medical practitioners here only learn about 5 hours of study on sleep, like in their whole undergraduate program. So, and from my personal experience in dentistry, it's zero. So, where I had no idea what an airway was, how to look at it, or any idea about sleep. Um, but fortunately, these days, a lot of dental practices out there have 3D scans, and I have one at each office I work at. So I have the very biggest one, which is about 20 by 20. So you can pretty much scan anyone's entire head and neck. Uh, so that's one of the tools I use every day, multiple times a day, to analyze a patient's entire head and neck. I can measure their airways. I can also to breathe properly and to sleep well, we need to breathe well. So the air supposed to pass through our nose. It goes all the way back down and all until it hits our lungs. So every part of the airway in the head and neck, I can actually analyze. And I also do send my scans off to specialists in those areas as well. One for medical legal reasons as well, just in case I miss anything. So my patients are always getting more than one opinion.
Mhm.
So, say for example, someone's a snorer. That means there's a blockage in their airway somewhere. And by simply taking a scan, I can figure out exactly where that blockage is. If the blockage is more in the throat region, there's things that I can do with people's jaws that can help them open up their lower airway and breathe better. If the blockage is up here, say they might have a deviated septum, crooked nose,
Mhm.
swellings in their nose from allergies, which is very common, sinus problems, then they're off to one of the ENTs that I work with. So I'm kind of like a GP as well in a way. So I diagnose the patient, well, I assess the patient, see where the problems are, and then refer them on to I work with about 8 different health professionals. So
Mhm.
yeah, so I have then the funny thing is the whole team I work with, everyone has actually treated myself in my treatment journey. So with all those health issues I had, it took about 3 or 4 years to get myself corrected.
Mhm. Now, are the solutions always surgical, or is there stuff that people can do on a daily basis to kind of fix or help with their, let's say, sleep apnea or their breathing patterns?
Yeah, in simple terms, for say an adult patient who has diagnosed sleep apnea, let's talk about how we diagnose it first. You got to undergo some sort of sleep test. So there's the better quality ones are usually ones done in either a hospital or a sleep clinic. But there's some really high quality take home ones where you go to a clinic, and then you take it home yourself. You wire yourself up. There's like anywhere from 8 to 12 different cords. So you do an overnight test. And then from the data, a specialist sleep physician can interpret it and diagnose you whether or not you have sleep apnea or not, whether it's mild, moderate, severe, whether or not it's something else. Some people have insomnia, narcolepsy, airway resistance. So it's up to the sleep specialist to diagnose that.
Mhm.
So once we have a diagnosis of sleep apnea, that's when so for an adult, there's mainly three most common solutions. One is the CPAP. Have you heard of that one before?
Yeah,
The machine that makes you sound a bit like Darth Vader.
yeah.
Yeah. So I mean, if it's a patient with severe sleep apnea, that's still the gold standard. I still mainly try and you know convince patients to go down that route. If that's the case, then they'll be working with the sleep physician to find the best mask and the best fit and the best control for them because there's different rates of the airflow. However, they're obviously, if they're a young patient, however, they're usually not so keen on that. So the other options are, yes, ear, nose, throat surgery if the issue is up here,
Mm.
and if the issues are more down here, then that's where I can do some help. Whether it's making a special appliance that brings the jaw forward to sleep to keep the airway open, or whether I go down the whole orthodontic route, where we can change the size, shape, and position of the jaws so to make the airway larger. So I don't know, if I go
Yeah,
side on,
yeah,
and if both my jaws come forward, the airway gets bigger as well in this region. So
right.
if the airway is bigger, they should be able to breathe better and sleep better.
Mm. Wow. So dentistry is not just the teeth. It's the jaw. It's everything in the throat area. It's a lot more immersed than most people think it is.
Yeah, in a way, yes, but this stuff is not really taught at university level, so not many dentists can do these sort of treatments. But the good news is a lot of dentists, especially young ones, whether it's on like social media and things they're reading online, they're becoming more aware of actually what an airway is and what maybe they should refer them off for further assessment, or refer to someone who can actually treat these problems. So a lot of my patients are actually referred, from even interstate, and on word of mouth as well.
Right. So, like most people who are, let's say, experiencing these issues, they'll go to their doctors. But if the doctors don't associate it with what you do, it's hard for them to refer them or tell them to go to these places, right? So, is having that assessment from an area dentist or somebody in that field something that you would recommend people to have on their list of people to go to and just kind of ask for them?
Yeah, it's a little bit tricky. Like there are doctors out there that are really aware of these things. It just depends on, any doctor, any dentist. Like we all have our areas of interest, our niche areas, and our areas that we're really experts in. So, I mean, I'm sure there's doctors out there as well that have just as much knowledge, if not more than myself,
Mhm.
in these areas. So, yeah, they're fine with treating, taking the lead and referring off and treating these patients as well.
Mhm.
But yeah, I do get a bit of kickback sometimes, because when we associate sleep apnea with a person, we're generally thinking of a more elderly, obese male.
Mhm.
That's most sleep apnea patients are, do appear like that. However, the ones that seem to slip through the cracks are actually like the the Asians, actually, the Asians and Indians. And a lot of that actually comes down to genetics. Okay, so Asians and Indians, genetically, we have smaller skeletal structures and we have smaller airways to start with. So
Mhm.
if we have a smaller airway, then we're more prone to having these conditions like sleep apnea.
Mhm.
So doctors, especially living in a Western country like Australia, a lot of doctors, when they see, say, a young, say, Asian female complaining of sleep breathing problems, they might just palm it off, and then they might do their Google thing online, and somehow they find their way to see me.
Uh, Now, for yourself, I know that basically the last few times I've seen you is at business conferences. Is that generally something that lots of dentists do, jumping outside of their industry and apply and attending different conferences, networking, and all that kind of stuff? Or is that something that you just find very fascinating to do on your own and then applying it to your dentistry?
I'd say yes and no, because in Australia, like in order to maintain our license, we actually have to meet a certain number of hours of, say, dental conferences per year. So dentists do go out there and, like, go to these conferences to learn and network. But in terms of, say, business conferences, it's probably pretty rare. Because I'm also really into personal growth. So like before I got into all this dental learning and all this journey, I actually started doing some personal development courses like a couple years before that. So I guess it's a personal thing. I enjoy learning new things every day, and yeah, I pretty much feels like I learn something new every day. Yes, I'm always doing a lot of reading every day.
Have you found that putting yourself in different industries and different areas, you're able to have an advantage over your competition?
In some ways, yes. In some ways, just say for an example, maybe, if I'm out there networking with people, I'm not so I would be more comfortable with different types of patients, whether it's elderlies or my
Mm,
age or young kids. Um, Understanding more about different occupations and backgrounds. Knowing a bit more about what's going on around the world so I can easily create conversation, build rapport with patients. Yeah, so I guess after a period of time, it becomes quite natural
mm,
because when we actually first graduate from dentistry, with our exams, especially our verbal exams, we're asked to answer questions in scientific language, so not normal everyday language. So if we use that I found that when I first graduated, like you're still talking in that way, and patients actually get confused or don't understand what you're talking about. So
mm,
I actually took some communication, like dental communication courses, after I graduated to improve my speaking skills.
mm. Nice. Well, that's another thing I want to touch on because you're very good at talking to your patients, your consultations. It's comfortable. It's very lighthearted. Is that something that you focused a lot on? Because lots of people are afraid to speak with their dentist because of what it may result in, right? Whether it's a procedure, surgical, whatever. So they're already going in with fear. How do you approach it so that you take that fear away or eliminate or reduce that fear so that it's lighthearted and comfortable?
Well, I think in a way that actually starts with your team. So from the moment, say it's a new patient, the moment they enter the office, how the team greets them. If it's say a child, do you have a child play area, a friendly team? Whether or not you have things that keep them occupied, watching movies while in the waiting room to keep them calm. So yeah, it really starts with the team, and then so once the team makes them comfortable, then yeah, it makes my job a lot easier. So firstly, yeah, I think it doesn't matter what industry you're in, it's really important to have a really good team around you
Mm,
for success. Yeah, in terms of being in the dental chair, I mean, I guess I'm generally pretty laid back. I mean, I think a lot of people fear the dentist because maybe of a past bad experience or
mm,
maybe a fear of being judged. I just like to I'm pretty straightforward. Sometimes I'm even a little bit blunt, but I'm just honest with my patients. Yeah, so I try and ask them open-ended questions to help them, open up and tell me what the real problem is.
mhm. So that's why when I go to dentists, there's always that little game that you play with your kids.
Yeah, yeah.
Those little figures. Is it actually true? Well, you tell me, is it do any of the dentists actually come up with questions purposely so that we try to answer with full sentences when we have stuff in our mouths?
Oh, well, not while you have stuff in your mouth. Uh, I think like it's very important as a patient walks in the chair, it's to build that rapport
Yeah,
first. So I actually, if it's for a consultation, I don't even get them to sit in the dental chair because for some people, just sitting in the chair just makes them nervous.
yeah.
So I just get them to sit in the normal chair on the side, and we're just face to face, just like two people meeting each other for the first time, having just a normal conversation.
Yeah, I was asking that because I'm like, why is this person asking me stuff when I can't reply? All I can do is
Yeah,
nod and say no. Um,
yeah, that's a little bit mean.
I know you speak on stages. You've been asked to speak at different conferences and lectures and whatnot. Was that always something that you thought you were going to do? Being on stages, speaking, doing lectures in front of many people?
No, not at all, actually. I only started teaching 5 years ago. So uh, I think, I guess, as part of personal growth, like you got to put yourself in, uncomfortable situations. So I was actually, my very first lecture, I still remember 5 years ago, I was kind of put on the spot by one of my mentors. So I was down in Sydney, and then we were just having a dinner, and then like he was teaching the next day. Then he literally, asked me to join the conference and put me up on stage. So yeah, it's a bit nerve-wracking at the start, but like with anything new, it takes a bit of practice, and and then eventually, like you do, there's a saying, you do something 5 times, and doesn't become so scary anymore.
Mhm. Is that something you enjoy as you do more of it?
I actually do. So, like, I understand initially when I was teaching, I'm thinking, okay, I'm sharing all my knowledge, and then what if like, what if these people end up getting better or surpassing me? You have those like, oh, it's competition. But then I soon realize I'm like, well, I'm always learning myself. So, we're always it's more like a camaraderie. We're all trying to push each other to set the bar higher, to raise the standard of healthcare. So
Mhm.
which is only going to benefit, the population.
Right.
Um, Also, I myself, I can only see a certain number of patients every day. So if I can teach more people to do what I do, then together, exponentially, we're helping more people around the world.
Right.
So yeah, it's a win-win for everyone.
Now, at the very beginning there, you talked about your journey in dentistry and how you started to specialize in the airway dentistry. Now, with regards to that, in some professions, if you niche too much, you get too advanced into one specific area, you kind of block yourself away from everybody else. People go, "Oh, this person's way overqualified," or "This person's way too niche." Is there any fear in that when you were choosing that path?
No, I don't think so because let's put it this way. Unfortunately, the baby boomers, the world population is getting a bit older as well. So as we get older, we tend to more have breathing and sleep problems and other health problems. Um, and then plus, I think the younger generation right now, the internet's like everyone's on the internet searching for stuff. I honestly, I reckon I get more new patients coming in from word of mouth and just randomly finding me on Google than actual marketing
Mhm.
from from my own marketing online. So
Right.
I think that's the way the world is. Everyone's becoming, especially younger generation, very
Mhm.
health focused. Yeah. And even medicine as well. Like rather than giving a drug to treat a symptom, why not look for the root cause and fix everything properly? So
Right.
that's what I do.
Cool. Now, when it comes to the you networking with different people and you learning so much that you learn outside of the dentistry area, is there an example where you've applied something that generally isn't done in dentistry, but applied somewhere else that has worked very well for you?
That's a tricky one. Maybe with social media marketing.
Hmm.
When I first started that back in 2019, that's when I started doing all the business courses. I built my own website, my professional Facebook page, and got an expert in the field to do the social media marketing for me. What happened was it just went boom. In some ways, it was good and bad because we were getting so many new patients calling in that the phone was just ringing like crazy. We didn't have enough staff to support that.
Hmm.
So yeah. So in a way it was good, but also we also struggled a bit to handle that. So and even some of those short videos I did on social media, some of them were, even had over 100,000 views. And then at times you also get, not everyone would agree with what you do. You even get a few hate comments as well, and learning how to deal with that. So that was a bit of a learning curve, and for both myself and the team,
Hmm.
how to handle those situations. So yeah, I think that's a little bit different to most dental offices who maybe just have a website, just do Google AdWords and basic things like that.
Right. Let's jump into that a little bit more since you mentioned it. How do you deal with that, the negative comments and whatnot?
Well, it depends who you talk to. I mean, some of my business mentors have said, look, yeah, you're getting somewhere or you're getting famous if you're attracting some haters. It doesn't mean I'm doing the wrong thing. I mean, but everyone's entitled to their own opinion, and there's different ways to to do things. There's other people out there that also, you know, treat airways, but might maybe do it a little bit differently. Like, say, for example, in a child, if I'm trying to, if they're got teeth crowding and I'm trying to develop their jaws, I may use a particular appliance that works best in my hands.
Mm.
But when I'm teaching, say I teach the dentist all different types of appliances, and I actually encourage them to try it all out and figure out what works best in their hands. So there's that saying, there's many ways to skin a cat. So as long as you have the same, the reach the same end goal, it doesn't matter how you get there. So every patient's different, every dentist doctor's different. Everyone has their own preferred techniques to
Mhm.
to get success.
Right. You've mentioned your mentor a few times during this conversation. What was some of the advice or some of the aha moments that you've gotten from your mentor?
Well, yeah, I mean, mentors, coaches are very important no matter what industry you're in, because there's, you know, you you no one rises to the top all by themselves.
Right.
So um, I guess with aha moments, I guess it started from when I started learning from him. Even say 10 years ago when I started learning in his courses, um, a lot of you get it firstly as a student, you get a lot of light bulb moments.
Mhm.
Like you start to piece puzzles together. Like you learn little bits of this and that in dental school, and then you're wondering how all the dots connect together. So it's putting the pieces of puzzles together. And I found even after I did the course, I didn't fully understand everything. There's a saying that doing is understanding. So I had to jump into the deep end and started first. I'm a very careful person. I'm very left brain analytical. So I start treating friends, start treating family first, using these techniques and
Ooh.
all these new things I learned, being very careful.
Mhm.
And then after I get the success and results, you build that confidence. And yeah, and then so it took me probably a good 2 or 3 years to actually piece all the puzzles together. I think having suffering all the issues, same issues myself, and going through a health journey, every step of the way, because it's so personal and intimate for me. It yeah, it really helped me understand and pull the pieces together. So I'm able to say, look, I can have this team of like all different health professionals around me and know like being able to spot problems and who I need to work with and refer to be able to get the best result for my patients.
Mhm.
So I think when we learn, a lot of people might be expert. You were saying like too niche. I'm like an expert in one area, which is still a good thing because you need those people as part of your team. So but then I'm the one that's able to put all the puzzle pieces together and then send the patients to the right people to get the best result.
Mhm.
So that was a bit of a challenge, but yeah, I think my own personal journey going through that myself really helped me put everything together.
I cringed a little when you said you first worked with your family and friends and close relatives and whatnot. Was that an easy ask when you approached them, or was there a point in time where they go, you know what, sure, we'll help you out, kind of thing?
Yeah, it was pretty easy because I think it was second or third year of dental school. Like you have to bring a family member in, and that's your first patient. So it's like your very first time you're giving a needle to a patient, it's on your family member. So I guess they were used to being a guinea pig.
Oh wow. When it comes to something like your legacy, right? For future generations to remember you for. What does legacy mean to you at this stage? And what are you trying to do to build that up?
Well, I graduated in 2009, so I'm 14 years in now. I still hopefully have a long way to go. So still slowly building up that legacy. I guess I haven't thought a great deal about that just yet. I guess from day to day, all I'm really focused on is trying to learn more, better myself, both personally, professionally as well. Um, I guess I guess the for me my legacy will be, I guess, when it's all said and done, how much I've contributed to not to dentistry, to healthcare, and the amount of students I've taught, and and the amount of patients, not just me, but the people that I've taught have been able to impact. And hopefully over the many years of my career, um, you know, slowly help change the next generation, especially the kids, getting them as healthy as possible. Just the impact I have on people's lives.
Well, being only 14 years in, you've already accomplished so many different things and already making a big impact. So I'm sure with your long career, you're going to make a really, really big difference in that field. Is there anything within the dentistry area that's coming in the forefront that's going to be revolutionary that you can share or that we can expect?
There's a lot of research going on all the time. I mean, there's, say, especially probably more so in the implant field, that a lot of exciting things there. We're always looking for ways to improve not just like all areas of dentistry, really, like better materials. Let's see. I mean, there's even people like with hospital medical procedures in dentistry as well. There's people using their hands and robots now doing procedures on patients. So um, that's fairly new to the industry. Things like stem cells, stem cells. So that's also pretty new to dentistry. There's now dentists out there who say, for example, um, you're unfortunately you need a tooth removed for some reason. It's beyond saving, and then but you plan to put an implant in there. So what they do is on the day of tooth removal, they draw out some of your blood. So they take out all the growth factors, and they put it into they take the tooth out and put it into that site. And what happens is all those growth factors and all those anti-inflammatory cells, they drastically improve the healing. And so most patients, have no pain after surgery. You see them back, the next few days, and they're pain free, and the extraction side just looks beautiful. The bone, the quality of bone, because that's really important for a dental implant. You need good quality bone to get the best success rate. So the quality of bone is also much better. It also buys the patient more time if they can't put an implant in there soon, because that bone, the quality of bone also lasts longer as well. So stem cells is a big thing. It's also big in medicine now too. I mean, a lot of professional athletes, rather than getting surgery, they might go do other words for stem cells are like PRP injections, PRF injections. People use that in hair regrowth as well. That's another area. Blood facials.
Yeah.
So all this, yeah, stem cells is huge, I think, right now all over the world. Yeah.
You also have a background in basketball, and
Yeah.
you played for your national team. You played for the state. Do you find that competitive mindset has transferred over to the way you approach dentistry?
No, yes and no, yes and no. I mean, I think yeah, sports cutthroat. It's brutal. You either win or lose. A lot of sports, there's no draws. So yeah, you got to go all out. I mean, in a way, yes. So in terms of my learning, my education, it's just yeah, it's just non-stop learning, trying to get better every day. So in that way, yes. But in terms of like, I don't see myself as competing with, other people. I see myself as going on my own path. So I'm my own biggest critic. So I'm very self-motivated to just keep pushing myself to be the best I can be.
Awesome. My final formal question for you is you get a chance to speak to everybody in the world, for everybody to remember Dr. Robert for. What would that one message be?
Like if I could say something to the whole world.
Yeah.
Ooh, that's a good question. Haven't really thought about that. Give me a second. Um, just I guess dream big. Never stop learning, never stop growing, and just be yourself and just be the best you can be. I mean, I'm not religious, so I just I believe I'm on this planet once, and make the most of it. Enjoy your life. Yeah, you know, help others. Try and make an impact on everyone you meet, and yeah, um, and and be kind to everyone.
Great words to live by. Finally, I'll give you a quick five questions. Give me the first thing that comes to mind. All right.
Okay.
You're stranded on a deserted island. One food to eat for the rest of your life, no consequence, so it doesn't ruin your teeth. Anything you want.
Oh man, I might go with probably steak. I love steak.
Like, awesome. Um, you're part of a circus. Which role would you like? The lion tamer, the ringmaster, the tightrope walker? Which one would you like to be?
Well, definitely not the tightrope walker because I'm scared of heights. Probably the ringmaster because I like, taking charge, making announcements, and speaking. Yeah.
Mhm. Monopoly calls and says, "Hey, we want to build a Monopoly game off of you, based on you. You get to choose five playing pieces that represents you. What are those five playing pieces?"
Are they? I haven't played Monopoly in a while. Are they animals?
Well,
Or
there's that car, that dog, the top
oh,
hat.
so it can be anything. Oh,
Yeah,
I don't know
like
all the pieces, so probably well, I'm not much of an animal person, so it won't be an animal. Maybe a car.
mhm.
Um, it's a difficult question for me because I don't know all the pieces. What
It's
else
just
is there? Is there a ball?
well,
Or
basically, it's the playing pieces that people choose, right? So they go,
yeah.
"Hey, I want to play. I want that piece. I want that piece," right? So, what are five symbols or five things that represents you the best?
Okay, so I can just say anything.
Anything.
Okay. A tooth, a ball, an aeroplane. I like to travel.
Mhm.
Maybe something food related. I love eating different kinds of cuisine. Oh, what's the last one? Mhm. Maybe the maybe a towel just to relax, whether you want to meditate or rest on the beach. Because I like, we everyone has busy lives these days, so it's also important to find some time to just have your own me time and just relax and yeah.
Mhm. Cool. Your doorbell rings, and a bunch of people show up at your door, and they're all unexpected guests to your home. You go, no problem. Come on in, and they're all hungry. So you go, no problem. I'm gonna go to the back and I'll fix you something nice. What's that special dish that you can prepare for all your guests?
Well, that would also depend on how much time you have. So, uh, and it also depends on how many guests there are too. So, now you can see how left brain analytical
So let's
I'm
say there
going.
two guests shows up unexpected, and you have all the ingredients that you need to do whatever you need to do, and you have about 30 minutes. How about that?
Oh, 30 minutes is not a lot of time. Um, well, I'd probably just hmm, probably something very simple. Probably just some sort of uh in 30 minutes, probably just some sort of salad,
Mm.
something healthy. In case one of those people is vegetarian, there's a lot of vegetarians and vegans these days, so you're not offending anyone. Yeah, so something healthy.
I was almost thinking that you're gonna say cup noodle, but very good choice. Salad. Number between one to four.
Three.
One, two, three. So if you had to relate success to a pillow, how is
Ooh,
success like a pillow?
how's success like a pillow? Oh, in terms with in terms of like my what I do, my occupation,
Well,
or
the success. So pillow as a metaphor for success.
hmm, that's a tricky one. I don't usually think of these things. Well, pillow is light, fluffy, comfortable, relaxing. I guess when you are successful, I guess you can, yeah, you're comfortable and you can enjoy your life a lot more,
Mm.
rather having to stress about things. And well, is a funny one. Obviously having a good pillow can help you sleep better. So, relating to my work, if I'm making people breathe and sleep better, then that's success.
Awesome. Awesome way of turning it right back to your expertise. Well done. Thank you very much for your time. Is there anything that you want to share at this moment?
Um, Yeah, well, if you're listening to this and you wake up feeling unrefreshed, you have head, neck, or jaw pain in the mornings, things like that. Yeah, don't yeah, feel free to go online. If you're obviously in Australia, you can find me. I work out of Brisbane. But yeah, there's plenty of health professionals out there all around the world that have some knowledge and similar to can do similar things to what I do. So you're not alone. So there's going to be someone out there that can help you. So yeah, just reach out to them.
Awesome. Well, thank you very much. So, for everybody, if you are experiencing any of that stuff, make sure you connect with Dr. Robert, an amazing guy, very, very smart in what he does, and very good with what he does, and a fun person to chat with. So, once again, thank you very much for your time. For everybody, he is Dr. Robert Lim. My name is Fong Chuan. Until next time, today is the day to lock your peak potential. We'll see you later.
Thank you.